surface anatomy. Surface anatomy is just what you see, what you can touch, so what you can observe and palpate through the skin. That's it. So we can see some bones or some parts of the bones, some muscles, tendons, joints, arteries, veins. The nerves, we cannot see them or palpate them, but we can know the pretty much a very good estimate of the location of these nerves. And this is very important. Uh, One, when we're examining a patient, an individual, a subject, a client, as a reference point, and also because these structures are the most superficial structures, the ones that are exposed to any type of injury during a trauma or any blow to the face or to the neck. We know what's going to injure first, depending on the location of the trauma. Now, let's start describing some of these structures. So look in here in my body, I can see back here. Okay, this is my occipital protuberance, which is just a I'm missing one image. Wait, and I cannot go. Okay, the occipital protuberance, which is just a bump on your occipital bone. So I want you, as we go and then as we describe all of these anatomical landmarks, please start touching your body, of your partner's body, and start feeling these structures. Okay, so occipital protuberance. What else? Well, it's in here again, the occipital protuberance. Now we're gonna move anteriorly and we're going to feel right behind your ear. Okay, so behind your ear, remember we can feel the mastoid process of the temporal bone. Then we can get to see the auricle, which is this part right in here, the auricle, your ear, and it has the external acoustic meatus that leads to the external acoustic canal within the temporal bone. Now, this rim, this border of the auricle is just the helix. This is the helix, the ends on the lobule, where we put the earrings, the lobule. Now, I want you to place one finger right in front of the external acoustic meatus, and that is your temporomandibular joint. Now open and close your mouth. Move it laterally. What you can feel moving in there is the head of the mandible, which is the end of the condylar process of the mandible that articulates with the mandibular fossa on the temporal bone and forms the temporomandibular joint. Now let's follow this bone, the mandible, and you can see here the ramus, the angle, and the body, right, of the mandible. So ramus, angle, and body. And you can feel right when you contract this muscle, elevate your mandible, and you're going to feel, well, right in here, the, can you see it? Your masseter bone, masseter muscle, I'm sorry. In this pretty lady, also the same thing. We can see here is the ramus of the mandible, the angle, and the body of the mandible. Right in here is where the masseter is, the masseter muscle, and right in this point is where we can feel the temporomandibular joint. Now let's move to the neck. In here so far, let's identify the clavicles. Okay, both the right and the left clavicles, and we can see in here the sternocleidomastoid muscle. Can you see it? All of this. And see that we can actually see the clavicular head, which is the one attaching to the clavicle, and the sternal head, which is the one attaching to the maneuvering of the sternum. Look in here, beautiful. The sternal head of the sternocleidomastoid, and this is the clavicular head. Same thing in here, the sternal and the clavicular heads of the sternocleidomastoid, and look how it ascends in the neck. Now, in the midline, where we can see right here, we can see the midline of the neck. Right in here, where the neck changes position from horizontal to vertical, we can palpate. We cannot see it, but we can palpate the hyoid bone. But you have to press and push a little bit deep because that's a very deep bone. Now, right there in the midline, we can see, especially in males, if not, we can see the thyroid cartilage first. And the thyroid cartilage is a cartilage, we can see it maybe here. It has a shape something like that, and it's part of your larynx. Now, under that cartilage, we can feel, usually not see, but feel the thyroid gland, okay, part of the endocrine system. So the thyroid cartilage, which is the Adam's apple, the laryngeal prominence, okay, that's the cartilage part of the larynx, respiratory system, and underneath that, the thyroid gland. Usually you can see them ascending in your neck as you swallow. Look at mine. I'm going to swallow and you're going to see these moving up, okay? Look. Or when I talk, look. See how it moves up when we swallow. Well, same thing in here. Again, about here is the thyroid gland, and this is the laryngeal prominence. Look how cool in here, how we can see. I'm gonna put it in blue because it's a vein. This is the external jugular vein. We cannot see it in here. In here, we can barely see it in here. Crossing the no, cannot see it. Crossing the external cleidomastoid muscle. Oh, look at it. Look at this in here. In here, we can see again the external and the clavicular head of the sternocleidomastoid. And all of this is the muscle. Okay, now look how it's crossing the external jugular vein, crossing the sternocleidomastoid muscle. The muscle that we have here posteriorly, that's the trapezius muscle. Okay, let's go to another slide. Okay, in here, what we can see, again, trapezius muscle, the clavicle, right? And the sternocleidomastoid from here to here. And in here we have the midline. Well, look at this laryngeal prominence. That's your thyroid cartilage. So all of this is the midline of your neck. So just like that, you can see that we have drawn two triangles. This is the anterior triangle and this is the posterior triangle. Let's see those triangles in this slide. Okay, so in here, again, trapezius muscle, now we are deep, okay? We remove the skin so we can see the structures. So trapezius muscle and sternocleidomastoid muscle. This is the posterior triangle, this is the anterior triangle. So the anterior triangle consists of the sternocleidomastoid muscle posteriorly. Anteriorly is just the midline of your neck, and superiorly is the mandible. So this is the mandible, anterior aspect of the sternocleidomastoid, and the midline. So that's your anterior triangle of the neck. Posterior, behind the sternocleidomastoid, But in front of the trapezius muscle, we can see the posterior triangle. So between the trapezius and the sternocleidomastoid, at the base, it consists of the clavicle. Now let's see what structures we can find in here. So we can find in the, where should we start? Let's start in the posterior one. In the posterior, well, we already described the external jugular vein that crosses over or superficial to the sternocleidomastoid and can be found in the posterior triangle of the neck. Also, we're going to find these yellow lines are nerves, okay? So this is the cervical plexus and this is the brachial plexus. One of the important branches that we can find in here is the accessory nerve, the 11th cranial nerve. Remember that this is the one that innervates the sternocleidomastoid, but also innervates a trapezius muscle. So in here we can see that how close this nerve is to both muscles, and we can understand why. Oh, that's why. And down here, from the cervical, cannot see it very clearly here. Let's see. From the cervical plexus, we are going to find this nerve is the only one that descends into the thoracic cavity. This is the phrenic nerve, the one that innervates the diaphragm. So let's see, or let's figure what's going to happen if we have a section of the phrenic nerve up here in class. Then what else? Well, that's in your external posterior triangle. In the anterior, very important, we can find the common carotid artery. And well, the common carotid artery is ascending behind the sternocleidomastoid in here and has two branches. This is the internal and this is the external carotid artery. And lateral to that, we're going to find now the internal jugular vein. Now, important is that here and in the anterior triangle, anterior to your sternocleidomastoid, and a little bit deep to the internal anterior border of the sternocleidomastoid, you can kind of slide the muscle to feel the external carotid artery and feel the pulse. Feel it right now. It's so at the mid-level of your neck, around your laryngeal prominence. Slide the fingers laterally, and right there, it's the external carotid artery. If it's not right there, push a little bit the sternocleidomastoid muscle and you will be able to feel it. Okay, let's see another slide. Now, let's see this guy. So in here, what we're gonna find? Well, we're gonna see the clavicle. Let's go first in red with the bunny things. So the clavicle in the sternum, the clavicular, the jugular notch, the body of the sternum. Then the sternal angle, remember, is this bump that you can feel in here when you slide the fingers. We're right there in between your fingers. There's the second rib. We can feel the infrasternal angle, the xiphoid process, right, the tip of your sternum, the costal margin, which is just the inferior border of all the ribs that you can feel separating the thoracic from the abdominal cavity. That curved line in here, that's your costal margin. Then what else? The iliac crest. I want you to place your hands on your hips, and the most superior bony part that you can feel in there, that's the iliac crest. When you follow that anteriorly, the bump that you can feel around here, that's the anterior and superior iliac spine. From there, from the anterior and superior iliac spine to the pubic crest and pubic tubercle that are located right in here, to feel the pubic crest, you need to push or press a little bit deeper in this area so you can feel a bump in the pubic bone. Now, in between the iliac crest and anterior and superior iliac spine, I'm sorry, and the pubic crest, we can find a ligament that follows um, the sulcus, the groove there is in between your hip and your thighs. And this is the inguinal ligament. What else can we see? We can see, okay, points of reference. Now we have, when you see, this is the clavicle from here to here. So in the middle of the clavicle, you're going to trace a vertical line down here, which is what they're showing you in here. That's the mid-clavicular line. Usually goes 1 centimeter medial to your nipples. Remember, these are the lines that we use to, well, it's a general reference point, but also to divide the abdomen. These two lines, and the other one goes through the costal margin, and the other one goes through the iliac crest. And in there you have your tic-tac-toe. Another line that we are going to describe in here is the mid-axillary line that goes just from the middle of your axilla down. Okay, it's a vertical line, another reference point. Important to place electrodes while doing an EKG or to describe injuries in the thoracic and abdominal wall. Next class, we're going to describe pectoralis major, serratus anterior. But in here, okay, let me show you two more lines that we can see in here. In the abdomen, we can see one is in the midline, the linea alba. Remember, the white line. This is the line that usually surgeons use to perform to open into the abdominal cavity, because remember, there is no muscles in there, so less chances of bleeding and faster recovery, less pain for the patient. Lateral to that, you're going to see the lateral border. You can see right in here the two rectus abdominis, right? And 1, 2, and the 3 intersections on that muscle. And lateral to that, you're going to see the lateral border of the rectus abdominis, that is the linea semilunaris. Linea alba, and here it is, linea semilunaris. And the other muscle that we can see in here is the external oblique muscle. This one and this one. Feel it. Go to the sides. Engage that muscle, of course. Flex your trunk, and you're going to feel the rectus abdominis and the external oblique muscle contraction. Now, in here, same things. We can see this is the linea alba. We can see here some of the intersections, abdominal intersections. This is the linea semilunaris. This is the external oblique muscle, and in here is the rectus abdominis. Superiorly, we can see here the clavicle, right and left clavicle. Looking here, we have the sternal and the clavicular head of the sternocleidomastoid and the trapezius. We can see also the jugular notch. About here is something that you can feel, not see, the sternal angle. This is the infrasternal angle, and about here is the xiphoid process. And about here you can touch just the body of the sternum. Well, look at the serratus in here. Okay, next class. That's it. Okay, remember, place your hands over your hips, and you're going to feel the iliac crest, and anteriorly you're going to feel the bump, anterior and superior iliac spine, the bone of that iliac crest, and from there the groove of the inguinal ligament. Now, posteriorly, there are just few things that we're going to identify as today. So one is this sulcus, this groove right in the midline, and that is called the posterior median furrow, which is right here. On either side of the posterior median furrow, we can feel the two columns of muscles, and those are the erector spinae muscles. Now, again, when you follow the iliac crest posteriorly, place again your hands on your hip. So in here we have the iliac crest, okay, the most superior, well, about here. I did it wrong. Let's go to the next picture. I did it wrong. I did it wrong. Okay. Better. So again, here we can see, come on. Okay, the posterior median furrow. Look at this. All of this is the the erector spinae muscle. One thing that we didn't see in the other guy is this dimple. And this dimple marks the place between of the sacroiliac joint. You would understand me now, right? The articulation between the sacrum around here and the iliac bone. Now, in the next picture, I'm going to show you, okay, I think it's better to see this. Okay, here we have the iliac crest, and the most superior portion of the iliac, or a trace a line between the most superior, let's see, okay, sorry for that. Okay, I have to finish this so I can grab this, take it out of the place. Okay. Okay, again, feel your iliac crest, posteriorly follow that, and if you trace a line between both the most superior point of each iliac crest, you're going to draw a supracristal line, like a line that goes in the most superior point of the iliac crest. Suprailiac, uh, supracristal line. And when you draw imaginary that line, you are going to pass right through L4. That's a perfect way to locate L4. Important when administering epidural anesthesia or performing a spinal tap. Organs, well, remember that in there we have the kidneys, the right and the left. The right is a little bit inferior because we have the weight of the liver pushes down a little bit the right kidney. What else do we have? Well, in here maybe we can see better. I know the picture is a bad quality picture, but we can see better the line. See, this is the supracristal line. This is one iliac crest, another iliac crest. You trace the line in here, and in there is where L4 is located. Okay, the rest of the structures in there is going to be discussed in the next class. But look, sacrum, coccyx, so you can like have x-ray vision from now on when you're seeing everybody, but not me.